Hi, survivors. Thank you all for joining us this evening, and thank you to all of our wonderful businesses and individuals who donate to Project Pink, because of you, we are allowed to give this program and all the programs we do for the breast cancer survivors in Nebraska and Western Iowa free because of their generous donations, and that's near and dear to our hearts, so thank you very much for that. We appreciate it. So tonight, we are going to talk and give you some healthy tips on how to improve your sleep so that you can sleep like a baby and get the beautiful, wonderful beauty rest you need so that you can heal your bodies. And so for the first half, we are going to do some education and then some Q&A, but you're welcome to send in your questions at any time through the course of the evening, and that will be wonderful. So my name is Lori Buckley, and I'm here with Dr. Dewan. Dr. Dewan is a professor and the program director of sleep medicine at Creighton University. He's board certified in internal medicine, pulmonary medicine, critical care medicine, and sleep medicine, and a diplomat of the American Board of Behavioral and Sleep Medicine. And he has given numerous presentations, locally, nationally, regionally, and internationally, so he is truly an expert. So we are just tickled pink that he is here with us tonight. And so I am going to just hand the evening over to Dr. Dewan and let him share his expertise with us. Thank you.
Thank you, Lori. I'm tickled pink to be invited as part of the Project Pink, straight talk. So the topic for this evening, I thought, I was asked to talk on sleep disruption in patients with breast cancers and survivors. So under that heading, I thought I'm going to tell you what are the most common sleep disruptions occur. Also talk about the different factors that might lead to sleep disruption, particularly in patients with breast cancer. And then finally, some management strategies that we can use to how to overcome insomnia and other sleep disruptions. So I just want you to let you know that sleep disruption in patients in general, in the general population, is extremely high. So you're not alone. But in patients with breast cancer, particularly when they receive chemotherapy, sleep disruption occurs in almost all patients. So the types of sleep disruption, the most common one is insomnia, and I'll kind of explain to you what is insomnia. The other sleep disruptions may occur is because of restless leg symptoms, which is an urge to move your legs incessantly that occurs more towards the evening and does not let you go to bed. It prevents sleep onset. And finally, because of certain medications, weight gain, postmenopausal status, some patients may develop sleep apnea. Sleep apnea is you stop to breathe during sleep, and that disrupts your sleep. So even though you may have slept for 8 to 9 hours, next day when you get up, you feel like you never rested. So sleep apnea may be one of the factors. But again, insomnia is 90% of the cause for sleep disruption in patients with breast cancer. So let me help you understand insomnia. So I said there are two components. One is sleep onset insomnia. So typically when you fall asleep, what's considered normal is if you fall asleep within 30 minutes of bedtime, then that's considered normal. But if it takes longer than 30 minutes to 60 minutes to an hour, then that's sleep onset insomnia. On the other hand, there are patients or individuals who may fall asleep in 30 minutes, but they awaken several times, maybe 1 a.m., 2 a.m., and they have difficulty going back to sleep. So that's referred to as sleep maintenance insomnia. So two components. So the other important thing to remember that you need to give yourself enough opportunity to sleep. If you're going to be up till 1 in the morning, you're depriving your body of enough opportunity to sleep. So insomnia is when your body is given enough time, you're relaxed, and still you're unable to fall asleep, then that's insomnia. And the result of insomnia is how you function the next day. Do you feel rested? Do you have daytime fatigue? Do you have low energy? So all these low energy, mood changes, etc. You may not be sleepy. So here's the distinction. Patients with sleep apnea tend to be more sleepy the next day because they do not have intrinsic insomnia. So there are certain traits insomnia patients have, and I'll talk about that later. But insomnia patients typically, despite lack of sufficient sleep, they are tired, fatigued, less energy, but not as sleepy. So, but they are at increased risk. They don't function too well during the day. So you're not alone. General population, the incidence of insomnia, whether it's short-term less than 4 weeks, or long-term, generally more than 3 to 6 months. Short-term insomnia can be as high as 30 to 50% in the general population. In patients with breast cancer, this goes up twice as high. So it's almost 80 to 90, 100% at some stage will experience insomnia symptoms. And I'll kind of help guide you to recognize and why those symptoms occur and what can be done.
That's a crazy number.
Yes, it's extremely common. And keep in mind, amongst the general population, 40% of the insomnia is in patients who have anxiety and depression. So that's the other connection there. 20% will be connected to medical causes. Just think about it. If you have chronic pain or you're hurting, a post-op pain will interfere with sleep. So that's the other component. Or GE reflux. So if you're having heartburn symptoms, that'll wake you up. So that's the cause for insomnia. And of course, drug abuse, use of stimulants, etc. I mean, that's understood. So, but these are the big categories that you encounter. So before I go further into what are the factors, I'm going to quickly give you a little 101 on sleep. What determines sleep, what leads to sleep, and how you can understand this component and improve your sleep quality. So sleep is generated by two factors. One is referred to as the homeostatic drive to sleep, and the other is the circadian drive to sleep. So the homeostatic drive is from the time you get up in the morning. So let me back up one. Circadian, we follow a 24-hour sleep cycle from 6 a.m. in the morning, 12 p.m., 6 p.m., 12 midnight. So if you look at the cycle, when you get up in the morning at 6 a.m., take that as a starting point. At that time, you've just woken up, your body's rested, and that's the time your homeostatic drive for the next 16 hours keeps on increasing. So when I say keeps on increasing, various toxins is referred to as the adenosine builds up in your body. That leads to more sleepiness. So 16 hours from the time you wake up is about 10 p.m. at night. So your homeostatic drive to fall asleep is maximum at 10 p.m. That's why most of us tend to sleep around 10, 11 p.m. The other component that determines sleep-wake cycle is the circadian. So at 6 a.m. when you wake up, daylight sets in. So light is a very powerful controller of your sleep-wake cycle. So if you follow this sleep-wake cycle, you find that in the morning hours, even though you may have had very little sleep at night, when you wake up between 8, 9, 10, and 11, you get what's called awakening because of the circadian drive. Then come in the afternoon, somewhere between 1 and 3 or 2 and 4 is called the circadian dip. So that's the reason you feel sleepy after lunch, because your natural circadian drive tends to drop a little bit. And then again in the evening around 6, 7, you're wide awake because your circadian drive pushes you up towards about 10 p.m. at night. So at 10 p.m., your homeostatic drive is maximum, circadian drive starts to drop, and that leads to consolidated sleep through the night. So there's one other element occurs around between 9 and 10 when it gets dark, is the hormone melatonin that is secreted by your body, in the brain, by the pineal gland. Secretion increases, and melatonin leads to more, promotes sleep, and that's why melatonin supplements are used. So melatonin helps to lead to sleep and then consolidate sleep through the night. But melatonin has some important functions other than promoting sleep. So it is controlled by regulation to light, so keep that in mind. That would be important as part of when we talk about managing, how do we manage patients. Melatonin increases at night to promote sleep, but melatonin is also known to suppress tumor growth. This is relatively new information. So long-term bright light exposures, particularly in nurses, there was a huge study done, 30,000 nurses participated in the study, who had worked on the night shift for 30 plus years. They had a higher incidence of breast cancer because bright light at night, when you're supposed to be sleeping, at that time, since they are working under bright light conditions, suppresses the melatonin. As a result, the growth of tumor was allowed because melatonin is a suppressor and is associated with breast cancer. So one of the major links between circadian regulation of sleep and breast cancer is, I think, the background that I just gave you. So there is an alteration in your biological clock that the changes in the sleep-wake cycle and the rest activity rhythm leads to. So the sleep disturbance that patients experience can be the consequence or the cause of circadian dysregulation. So this circadian disruption by itself, even if you do it by undergoing shift work. So being up at night with bright lights can alter the circadian rhythm and contribute to more advanced disease. And the tumor survival in patients, there's some early data suggesting that disturbed circadian rhythm can be associated with shorter survival. So it's important to maintain good sleep-wake timings and try to get sleep during the nighttime hours. Circadian rhythm is also being recognized. I just talked about breast cancer, but it has also been recognized that it controls a lot of clock gene mutations. I'm not going to go into that right now, but it also regulates your mood, depression, quality of sleep, early cognitive changes, and metabolic and cardiovascular changes, diabetes, weight gain, hypertension, cardiovascular disease. So there's new data coming every day that are linked to circadian changes, circadian disturbances. When it comes to breast cancer itself, how at the breast cancer at the cellular level alters some of these changes and interacts with your brain cells, interacts with your endocrine system, interacts with your metabolic system, and also impacts immune system. So as example, immune system, if you've had less sleep, which is sleep deprivation, it is linked to your body does not generate enough antibodies in response to vaccination. It may be studies were done with influenza vaccination or pneumococcal vaccination. They showed that if you've had less sleep, the amount of antibody generated is lower, so immune function is affected. So it is these systemic symptoms that tend to occur, and particularly in conjunction with the cells at the tumor level. So this is the tumor cells talking to each other through metabolic pathways, molecular pathways, and interact and produce all these changes that you will see when you present with advanced breast cancer. So when we talk about the immunity and the metabolic regulation, sleep disturbances and fatigue. Fatigue is, in fact, one of the most common. Besides not getting sufficient sleep, you feel fatigued next day because you didn't have enough sleep. But fatigue can also be, despite getting enough sleep in patients with breast cancer, is because of the molecular changes that occur at the cell level. So it gives rise to symptoms what are suggested as sickness behavior, because you feel like don't feel good. And sickness behavior is linked to the pro-inflammatory mediators. I'm sure you've been hearing regarding COVID illnesses. COVID illness also releases a lot of pro-inflammatory mediators in your body, and which is very harmful. Similarly, breast cancer patients have all these mediators, and when chemotherapy is given, that doubles the pro-inflammatory mediators, and that's why you don't feel good at all when you receive the chemotherapy. But that's generally short-lived. When I say short-lived, can be 3 weeks, 4 weeks, or longer. And this has a bidirectional effect. So what do I mean by bidirectional effect? Is sleep disruption causes sleep deprivation. So in other words, you may have been in bed for 8 hours, but yet you slept only 4 hours. So 4 hours of sleep is not sufficient, so that's sleep deprivation. And sleep deprivation promotes more pro-inflammatory cytokines. So it sets up a vicious cycle leading to, worse symptoms. So sleep disruption is also linked to weight gain through different mechanisms, and overweight contributes to low-grade, just obesity contributes to low-grade inflammation, and then increased risk for sleep apnea, and then daytime sleepiness. So this is the cycle that one goes through. The other components, particularly as it relates to insomnia, just think about it. You've just received the news that you were diagnosed with breast cancer. So what are the thoughts that go through your mind? You're thinking of anxiety, right? Fear of the unknown. What's going to happen? All the testing that will be needed. It's not just X-rays, but it's invasive testing, biopsies, and then possible surgery, and then what the outcome would be, what the survival, what chemotherapy. So all these unknowns, and it's a huge, extremely stressful time. And extreme stress can lead to depression, fatigue, and depression is very common, 20-30% or higher in patients with breast cancer, and more so in advanced breast cancer. And also some recent data seems to point that particularly in minority women, because of limited resources, their stress level can be even twice as high. And that can lead to almost post-traumatic stress disorder in some patients. So it's a vicious cycle. One needs to understand, one needs to recognize that it's there. It's not the end of the world. It will get better. And how do I use the tools and resources available to me to overcome that?
That's a big question.
That's the big question, absolutely. But the more knowledge is empowerment. So what I'm trying to do right now, educate you on the causes for sleep disruption, recognize that this is not the end. If you miss sleep on 1 night, 2 nights, 3 nights, yes, it's hard on you, but at the same time, you will overcome. And I'll show you how to overcome. So other factors that lead to sleep disruption is the chemotherapy and the hormonal treatments that are used as part of treatment. Tamoxifen, we all know over the years, has been linked to hot flashes and then sleep disturbance. There's a metabolite called endoxifen released through tamoxifen. That's the one that has been correlated. Then all the other chemotherapy agents and antihormonal, particularly the class of agents called the aromatase inhibitors. So these are the drugs like letrozole, anacetrozole, raloxifene. These are all various hormonal treatments, and they can lead to nausea, hot flashes, and pain sometimes. And systemic glucocorticoids. Now, systemic glucocorticoids, think of prednisone, that's commonly used. And prednisone is a stress hormone. Think of when you undergo stress, your body steroids go up. You get sleep disruption. Same thing anytime if you're given prednisone, that's going to cause sleep disruption, but that will be transient, things will get better. But it certainly can disrupt your circadian rhythm. And some of the other newer chemotherapy agents like the tyrosine kinase inhibitors, which are the small molecules, and also Herceptin receptor type of medications can also affect sleep. So here's the important component. I'm going to discuss what causes insomnia, what leads to insomnia, and will insomnia stay with you once you get insomnia. So there's a theory called the Spielman's 3P theory. So what's the three? The 3P stand for, number one, predisposition. So you're more likely to get insomnia if you're predisposed. But women are more predisposed than men. That's one. Two, anxiety trait. So if you're an anxious personality, if you tend to be a light sleeper, then that's a trait that will increase your risk for insomnia. And a family history of sleep problems would also be a third predisposition. So on top of this, when you get precipitating factors are the triggers. So trigger can be any stress of any kind, and I showed you earlier that how a diagnosis of breast cancer is a huge trigger, right? So stress related to the diagnosis of breast cancer, cancer chemotherapy, etc., and the physical pain, the nocturia, getting up frequently at night because of bathroom trips, anxiety, depression, all this lead to the triggers for insomnia. Now the third P stands for perpetuating factors. So I'm going to stop here and say that yes, most of you will get insomnia during the time when you diagnose breast cancer and the treatments. However, after you're recovered from breast cancer and the treatments, your insomnia could go back to normal or may not go back to normal. This is where you can control. So the perpetuating factors is how you respond to your insomnia is extremely important. So factors for chronic sleep disturbance. So how you respond means your maladaptive responses is what will determine the long-term outcome that your insomnia may stay with you. So let me give you an example, like if you focus so much on sleep or the lack of sleep or inability to sleep and you're watching the clock all the time through the night, then it becomes a vicious cycle that leads to this maladaptation response. And even though your stress may have gone, but now you're left with insomnia long term. So, and I'll show you how to break that cycle too. So, the management strategies are going to be three major, one alternative complementary approaches, but cognitive behavioral therapy. So I just want to mention we have pharmacological therapy. I don't give too much emphasis on pharmacological therapy because they are just, they help you to control insomnia on a short-term basis, but then I'm going to talk about cognitive behavioral therapy for insomnia. So what is cognitive behavioral therapy? Is training your body to learn, adapt to what's happening, and some of the tricks to help overcome long-term chronic insomnia. So the first component is referred to as the stimulus control. So stimulus control is to extinguish the negative association while promoting a positive association between sleep and bed. So if you go to sleep at night and unable to sleep for longer than 30 minutes, beyond the 30 minutes, then you should get up, go to a different room. Don't put on the TV. Too bright light is not good for you. But do some quiet reading, and then when you're tired, you're sleepy, you come back and go to bed. So this is referred to as the stimulus control. So in other words, you're associating positive the sleep with your bedtime or when you go to bed. Move away from the bed if you've been unable to sleep for 30 minutes, and don't be watching the clock. So the stimulus control. 2, relaxation training. It's very important before your bedtime. You try to relax yourself, your mind and body. You just have to power down, right? Just like anything else. And then there's some progressive muscle relaxation exercises. You tense and relax, and you'll find that your body will slowly start to settle down. And also, this is more important, relaxation in individuals who are cognitively hyper-aroused, that they're very anxious. So it certainly will help you to relax. And whether you want to use some light music during this time, that'll help, or imagery or different techniques can be used. And then the cognitive behavioral combination therapy, which is combining cognitive, which is telling yourself that if you don't get sleep one night, it's not the end of the world. You're going to live. So 3 hours, okay, no problem. You'll catch up next day, but you need to relax. And so once you start changing your cognition and your response, your body's response, and combining with the stimulus control and the relaxation, it'll certainly help improve things. The next component, the fourth component, is referred to as the sleep restriction. So if you may be spending 7-8 hours in bed and yet you sleep only 4 hours. So 4 hours out of 8 hours. So one way to promote more sleep consolidation is to restrict the time in bed. So that's the restriction in bed. So typically, I recommend that you pick a rise time that's desirable for you, whether it's 6 in the morning or 7 in the morning, and then at least allow yourself 6 hours in bed. So if your desired time is 1 p.m., is at say 7 a.m., 6 hours before that would be 1 a.m. So if you're sleeping only 4 to 5 hours but spending 8 hours in bed, then you wait till 1 a.m. to go to bed. You have 6-hour time. So the goal is to increase your homeostatic drive. Remember I said, from the time you wake up in the morning till 10 p.m., you'll be very sleepy. But because your sleep is getting disturbed 2 hours here, 2 hours there, so by not going to bed till 1 a.m., you're increasing your homeostatic drive, and then you'll get more consolidated sleep. I can tell you this works very well in conjunction with other therapy and promotes sleep consolidation, and when you wake up next day, then you'll feel better. Once you've achieved enough sleep efficiency for 5 out of 6 hours, then you slowly advance your bedtime to 12:30 to 12, 11:30, and that's how you'll be able to get up to 7 hours, 6 to 7 hours of sleep. So this is sleep restriction, and then biofeedback, again relaxation, etc. And then sleep hygiene. We talk about so many elements of sleep hygiene. So I'm going to emphasize the most important out of these is regular sleep and wake cycle. So in other words, don't be going to bed at one day at 2 a.m., one day at midnight, one day 11 p.m. And then rise time could be 7 a.m. to 11 a.m. Because this is like your body is going through jet lag. Have you ever traveled from here to East Coast or to Europe or to the West Coast? So it's referred to as the social jet lag that occurs right in town, even though you have not traveled. So that's important. So regular sleep-wake schedule is an extremely important component, and others would be controlling your environment, temperature control. Cooler temperatures promote better sleep. Avoiding napping during the day, especially late in the evening, and then avoiding caffeine. Caffeine maybe after 3 p.m. or so, or even, again, depends on your own sensitivity. There are some people, I myself, before I could have coffee at 9 p.m. and go to bed at 10. It didn't bother me, but now it does. So there is an interaction. Age and caffeine can change. Avoid nicotine, avoid alcohol. Alcohol is a double-edged sword. People drink alcohol as a nightcap, remember? So a nightcap can put you to sleep, but when the alcohol is gone from your body in the next 3 hours, you'll be up. Your sleep will be disrupted at 2 or 3 in the morning. Try it. I'm not saying try it, but and other stimulating activities. Yeah, do not watch your stocks late at night. So that would be will stimulate your mind and affect you. So those are some of the tricks to help treat your insomnia. So cognitive behavioral therapy, very effective, long-term, works. I'm going to switch to pharmacological treatments. Generally, I reserve that for short-term use of medications. I'm not going to go into all the details of medication except to say lorazepam, which is a benzodiazepine, it relieves your anxiety. So any class of agents that are benzodiazepines, short-term, that if you're highly anxious, then benzodiazepine like lorazepam or Xanax will work better. The idea is to use short-term. Zolpidem or Ambien is the other name, or Lunesta, different names that are there, is a non-benzodiazepine type of agent. And this may not relieve your anxiety, but certainly will put you to sleep. And this can be used on a short-term basis, especially when you're receiving chemotherapy. It'll certainly help you to sleep during those times. Now, melatonin has been tried. Melatonin may work, may not work in every group of patients, even though that's the physiologic function. Melatonin as a resynchronizer, resynchronizing your circadian rhythm, has been tried. Benefit is limited, so more data is needed, but certainly can be helpful. What is more helpful is your daytime activities. So daytime activities and exercise and moderately intense physical activity during the day will improve your quality of sleep, sleep-wake cycle, because you've been exposed to bright light. So even though you may feel fatigued in the afternoon, so daytime exercise, which promotes better sleep at night, and then your immune function and daylight exposure helps circadian resynchronization. So it'll allow you to sleep better through the night rather than sleeping at different times of the night and day. Do you know what's cat napping? Why do you say cat napping? This is the anecdote, but cats do not have the circadian cycle. So they sleep for 2 hours, and the homeostatic drive controls their sleep. And then once they get their 2 hours sleep, they're up. Again, the next 2-3 hours, the homeostatic drive goes up, they go to sleep again. So it's cat napping. So try to avoid cat napping throughout the day. And the last one is the complementary or alternative interventions, such as targeted bright light therapy during the day. If you're in a, say, in a place, location that does not have bright light, or during winter months. So bright light during the day will help you improve your sleep-wake cycles. And then also yoga programs, because it provides relaxation. Some exercise certainly would help strengthen your sleep cycle and then reduce your medication use. I could leave this for question time, but I'll talk about it since this is something very common, CBD oil and cancer. So I thought, so just want to make clear, marijuana and hemp, they come from this cannabis plant, sativa plant. there are two components of this marijuana plant. One is the THC, which is the tetrahydrocannabinol. This is the psychoactive component, THC. So this CBD oil does not have the THC unless it's the over-the-counter version. Sometimes there may be contamination. The CBD component, so CBD is cannabidiol. It is not psychoactive. So it is this component, CBD oil. But CBD oil, I looked up the data in the literature and found some articles from MD Anderson Cancer Center in Houston. It does not cure cancer, so don't be trying CBD oil. But CBD oil may relieve some of the side effects of chemotherapy, but it is not FDA approved, such as nausea, anorexia, anxiety, and insomnia. There is a synthetic CBD called the dronabinol, which is approved for nausea, vomiting. So again, it's not used very commonly, but certainly is there. And remember, potential risk of CBD oil, it is not standardized, so therefore, if it has more THC component, it may lead to some psychoactive effects and may also damage the liver sometimes, which is liver enzymes are impaired, leading to some drug-drug interaction, especially a lot of your chemotherapy agents. So in summary then, what we talked about is the sleep disruption being most common, insomnia number one amongst them, and all the different factors that can lead to sleep disruption and insomnia. And then management strategies we talked about with emphasis on cognitive behavioral therapy, with short-term pharmacotherapy, exercise and moderate physical activity, and the targeted bright light exposure in some cases. So thank you, and I'll be happy to answer any questions.
So we don't expect you to know everything that's out there on the free market, but there are like vibrational headsets that they say stimulate the brain and help you with sleep. And then there's also some like FDA approved like neurotransmitters that are stimulators, I mean. What are your thoughts on any of those?
These are relatively much newer type of devices. I personally have not had much experience with them. The idea is to do transcranial stimulation to promote slow wave sleep. Mm-hmm. So I've read a little anecdotally, but not a detailed literature as to how efficacious these agents are. But certainly the idea, the concept is to synchronize your brain waves into sleep waves. Mm-hmm. And if it works for some patients, great. Try it. Yes. Yeah, yeah.
What are your thoughts on any of the insomnia apps? Are you familiar with any of those?
Yes.
And do you have any that you would recommend?
There are a variety of different apps. Many of them are paid apps. I couldn't name a specific one, but certainly the apps do a great job providing cognitive behavioral therapy, because every week you can touch base with the app and they guide you through the process. So the answer is yes, apps are extremely beneficial, and there are a variety of apps that are out there. In my practice, I refer patients to the psychologist for managing this, or I give these instructions that I discussed with you today and give them a paper sheet to maintain a sleep diary that they can maintain. But apps would be a great way to apply cognitive behavioral therapy, yes.
Yeah. That's really a great thought of like tricking your mind into sleep. If you're only sleeping 4 hours, just go to bed those 4 hours and then try to do it. I wouldn't have thought of that. So I think that's awesome. I fall asleep easy, but then I wake up all night long. Any suggestions for that viewer?
Yeah, so you fall asleep easy but wake up all night. So that's what I was referring to is the sleep maintenance insomnia. So in fact, in clinical practice, anytime when I see someone who's waking up several times, the first step I try to do is to make sure they do not have underlying sleep apnea. Sleep apnea can also contribute to insomnia, not just daytime sleepiness. So having excluded the sleep apnea, because sleep apnea is treated differently with CPAP or oral mandibular device, then certainly using cognitive behavioral therapy with the component of sleep restriction is extremely helpful when you've been awakened several times through the night, and this would help. I also make sure that the cause of awakening, if there's some physical cause, pain or bathroom trips, then I'll say, let's look at that and treat that first before we try to use the cognitive behavioral therapy for those patients.
Good sense. How do I find a good cognitive therapist?
That's again a challenge. That has been a challenge because they're extremely. One of the things with cognitive behavioral therapy, and it is not well reimbursed by insurances. So I think apps certainly, and I would say the psychiatry department within CHI system, they have some of the therapists who can provide, but they are in short supply.
So there are lots of over-the-counter supplements out there.
Yes.
Some of them have the melatonin. Do you have any that they should absolutely stay away from, or any that you think are better than others for recommendations?
So in terms of melatonin, again, there's several products on the counter space, and melatonin may work for some and may not work for others. The dose for melatonin can range from 3 to 5 to 10 to 20. But I would say most commonly anywhere between 3 to 10 milligram dose, taken 1 or 2 hours before bedtime would be most helpful. You can try it, and if it seems to work for you, then I would stick to the same brand of melatonin. I know nowadays we get melatonin gummies, which are 3 to 5 milligram gummies, and you can try that. So in terms of a specific brand, I would say is a variable response. Other over-the-counter medicines, which is most commonly used, is Tylenol PM or various Advil PM. They all have Benadryl. Benadryl is an antihistamine. They tend to cause dryness of the mouth. Typically, that's not as desirable if you have issues with bladder retention. Sometimes some side effects that may occur because of the Benadryl. But again, it's in lots of over-the-counter medicines that Benadryl is included as a sleep aid.
How can I build up my? Can I build up my immunity to melatonin?
Or like build so it doesn't work as well.
So the question is, can I build up immunity to melatonin? You're trying to use melatonin to set up your circadian rhythm. If melatonin helps you to sleep better through the night, and a good night's sleep then will keep you active during the day. So I would say building up immunity with melatonin. So that's an extremely great question. In fact, there was some recent paper that used 20 milligrams of melatonin to see if their cognition would improve in patients with breast cancer. So in that small paper, the use of melatonin 20 milligram did seem to help improve their cognition. So it was not as immunity as much as but cognition. But if you're referring to melatonin as helping to improve your survival from breast cancer, I would say the data was the reverse, that patients who have circadian disruption, which is melatonin disruption also, they had shorter survival. So if you flip the other direction, perhaps it could. Studies have not definitely demonstrated that yet.
So what is the role of sleep disturbances in general for reoccurrence? Is there any tie-in there?
The role of sleep disruption and recurrence of, so certainly some data have implicated that long-term sleep disruption shorter survivals. So if you can prevent the sleep disruption by measures like daytime activity, exercise, exposure to light during the day, will allow you to sleep better at night, will improve your survival.
What are your thoughts on like acupuncture or hypnosis or essential oils to help with sleep? Do you have any thoughts on those?
I have not used acupuncture because it's an active process at bedtime, but certainly lavender oil, I've heard, if that sometimes may help you to sleep, relax. I think any of these aids, if they can lead to relaxation, would be helpful. People drink milk at bedtime. It has tryptophan. Tryptophan is a component that helps to promote sleep. So any of the aids that, if they work for you, certainly I would try it.
Yeah. My grandma was always on the warm milk and honey
Warm
thing.
milk and yes,
Yeah,
yes,
because
absolutely.
the warm milk increases serotonin, doesn't it?
Increases. It has tryptophan, and tryptophan is an essential component for making serotonin.
The serotonin, yeah.
Yes.
And then she said the honey would make all that happen
Yes.
faster. So you have to put the two together. So try more milk and honey like Grandma did, because that worked for her. So are there any of herbs out there, like lots of times people try herbs, is there any herbs that they should not be looking at that are promoted for sleep that actually could interfere with any of the cancer drugs?
I'm not totally up on, but valerian root is used commonly to promote sleep. It does work, but interactions, I'm not totally certain, but some of them may, so that's something to be checked.
Yeah, you can check with your local pharmacist on
Yes.
that, who's ever asking for that. The sleep medications are sometimes, can they be addictive for them? And how long is it safe for them to take those sleep medications?
Sleep medicines, particularly benzodiazepines, you can get addicted to them. But again, so what's the long-term duration? On the benzodiazepine side, I typically try to limit it to less than 4 to 6 weeks, 8 weeks, to under 3 months. On the other hand, the non-benzodiazepine agents like zolpidem, Ambien, again, the studies all recommend to use 3 to 6 months. I've seen studies where zolpidem has been used up to a year, and if you use to for almost a year, then it's a little harder to come off those long-term treatments. That's where cognitive behavioral therapy may allow you to slowly reduce wean yourself off these long-term pharmacotherapies and build up your body, condition your body to sleep better long-term and slowly wean yourself off the other agents.
Yeah, be the best way, because you don't get addicted to anything, and it's a life skill they can have forever.
It's a life skill, plus at the same time, I mean, sometimes these prescriptions are given, and then when patients do not come back for follow-up, they get used to it, then it's like, it becomes difficult, but certainly can be tried, and that would be my approach.
So the cognitive therapy obviously is the winner.
It's the winner.
It's the winner. So do you have any suggestions on books or websites if somebody wanted to do a little self-coaching or teaching themselves through that?
I would say I would explore the apps. The apps are very effective because the books will just tell you about the principles, but the apps will give you exactly follow the steps and on a weekly basis.
You're cool and hip. You're up on all the apps, huh? Well, thank you very much for sharing all that with us. Thank you, viewers, for joining us tonight. I would like to just give you a little update on the things that we have coming up for Project Paint. So make sure that you check out our website, projectpaint.org. We are super excited about our new series we have coming up. It's called The Bold and Brave Conversations. And so through this, we're going to talk about all of the things that are the difficult conversations for those of you who are dealing with METs and the journey that you have to go through that. Each month we will have a different topic through that, and our first one starts in 2 weeks. And so please look on the website for that. And then also yoga will be starting up in October, so please look for that. And check out our Zoom socials for the newly diagnosed and those with cancer METs. And please join us for all of those activities. And once again, thank you to all of our generous donators so that we could bring you this evening. And thank you very much for sharing your expertise. You're truly a sweet individual, and it shows, your passion shows through, and we appreciated your time tonight, so thank you for that. So Project Paint's mission from the moment of diagnosis through the end of life is to bring you tools, resources, and a strong network to help your mind, body, and spirit grow for all of the women in Nebraska and Western Iowa. So thank you so much for your time. Good evening.